My child is actually my niece, and I got custody of her after her mother died at age 6. But up to that point, she had had a very turbulent, traumatic early childhood. And really, by the age of 5, we knew that she had a lot of emotional problems, behavioral issues, and we started seeking counsel for her. And then her mother passed away at 6. So I continued her therapy, and it was at that time that she received the diagnosis of reactive attachment disorder, which I had no idea what that meant. And she would have very sporadic behavior, very, one minute she might seem to be fine and very caring, and something would set her off, and 5 minutes later she could be throwing a screaming temper tantrum, and there was nothing reasonable that would happen that would set her off. It could just be immediate that she would have these changes of emotions. And as she got older, the behavior got more extreme. She became more aggressive. So she went through a series of behavioral health programs from her counseling. We received in-home support. She worked with the Children's Hospital in our area. She really went through every program that was available to us. Everything that was suggested for her, we did, um, until she had exhausted all of the resources that were available where we lived. And I knew that she needed more extensive help, that we'd done everything and she just wasn't getting better. She had people that cared about her in the professional world. It's not that they refused to help her. They did as much as they knew to do, and they just really didn't know, anything else. It got to a point where the only suggestions that they could offer me was to turn her over to state custody and put her in a state facility, because there was nothing left to do. And I wasn't willing to do that. And to be told, well, if you give up custody, then the state will take over because you're out of options. And how can you accept that as a parent? How can you accept there's nothing else to do? We can't help her anymore. But if you put her in a state facility, then they'll just try to control her behavior. That's a horrible thing. It feels like you're giving up on your child. Found a lot of information online and just started calling places, talking to different facilities, therapy programs, and explaining our circumstances to see if their program might be the right fit for her. When I talked to Forrest, I found someone who actually understood what I was going through, what she was going through, and could completely relate to our experience. And I didn't hit a brick wall like I had done so many other times. And it was just wonderful to be able to talk to someone who could offer some insight and offer advice and guidance and support, and be able to really explain to me that the program, it was there specifically to help kids like McKenzie. The Institute has a very thorough set of evaluations that I completed about McKenzie, about her biological parents, about her early childhood, about myself, and what McKenzie's life has been like since she's been with me, and the therapies and programs that she had participated in. So they didn't just look at the past medical records to make an evaluation. They really did their own evaluation and observation of McKenzie, what her background was, clinical background, and also what the hereditary background is. So after I completed all of the testing and evaluations, there was a determination made that the Institute could help her, could work with her. And that was important because I didn't want to place her in the Institute if it wouldn't be the right fit for her, because I'd actually already done that 2 times before and placed her in therapy facilities that couldn't help her. And actually, one facility, I took her and she was admitted on a Friday, and Monday morning they called me to say they couldn't handle her. And it's again so frustrating and defeating to think, well, you had all her information, you knew what her background was. So if you didn't think your program was the right program that could help her, couldn't you have seen that before I admitted her?
Mhm.
So I didn't want, and that's just more turmoil and disruption for her to go to these places and feel like I've been in 4 or 5 other facilities and treatment programs and hospitals, and then the child feels frustrated and hopeless. So when Forrest advised that the Institute could work with her, and they had experience with kids with her kind of background and with her behaviors, um, I I was really thrilled. And after I brought her here and met Forrest, met her therapy mom, I really felt like a weight had been lifted because I felt like I had done the right thing, and and I have, and that's obvious in her behavior now. When she came here, she was very troubled. She was very um, unstable. She is very angry. She could be aggressive, physically aggressive. That to be a young child, she never seemed happy. She didn't seem like a carefree, innocent child should be. She always seemed like there was something wrong. She was mad, or she was upset, or she just always had a frown on her face. And it seemed like there was a dark cloud over her. She didn't smile. She was just not a happy kid. And now the the most rewarding thing is to actually see her laugh and smile and be able to communicate and not get angry at everything, and and to see her smile. That's something that I really didn't see very much before, because she was so disturbed and so insecure that she couldn't let that come out. She couldn't let any of that inner, she didn't have that inner sense of happiness and peace in her life. And now that shows. And she smiles and she laughs and she jokes. And that's just wonderful that she jokes, that she laughs at people and she makes jokes and she can, laugh at herself even now and not just be torn up and angry if, everything in her world doesn't go her way. She doesn't throw temper tantrums anymore. She can accept that because she's found a sense of security and foundation that she didn't have before. I made the decision to move here so she can be an outpatient in the program. She's developed such a strong rapport with Bev, her therapist here, and with Linda, who is her therapeutic house mom. I wanted to try to keep that same stability. That was a very difficult decision, but I felt like she needed to continue the support that she's received here, and I was concerned about not being able to continue to have the same type of services at home as the therapy that she's been receiving here. I couldn't find therapists that had the same extensive background in attachment therapy. I wish I had known before that there just weren't the resources where we lived to really provide the help that she needed. And it's such a difficult journey when you're dealing with mental health issues because you do everything that you can, you do everything that the professionals recommend, and it's not a quick fix. So it's not like a medical issue where you can take medicine and see if it's really making any progress or not. It's such a long process to go through counseling, to go to weekly therapy sessions. So you give it time and think, we're just going to have to wait and see if this helps. And when it's not helping, you continue to do anything else that you can think of that they can offer you. You do it all. And it really took 5 years to realize you've done everything and it's just not enough. And you need more intensive help. And in the meantime, that's 5 years of this little child's life that if you had known that at the beginning, you would have cut out all of those steps and just gone right to the intensive help to begin with. But you don't know that. So you're just experimenting. So the sad thing as a parent is to think you're experimenting with your child's health and well-being. And you wish you could have helped her more when she was younger and possibly saved her some pain. But you don't know that. So I wish, yes, that I would have known it wasn't going to be enough until we came here. But I'm still very grateful that we found the Institute. So that was a blessing. And she's getting the help she needs. And she's making the improvements. So I have a much healthier feeling about what her future is going to be like. And the thing I would say is I wish that our mental health system could be more effective, that there could be more knowledge and information shared across the country so that it wasn't so difficult to find the help that your child needs.